Hi everyone, welcome to my page. My name is Dr. Nkiruka Bridget. My name is Dr. Nkiruka Bridget. Please join me live. I want us to talk about health. I want us to talk about health, how to take care of your health, what to do. If you have any question, you can ask me. Please share this live, like, follow my page, subscribe at Dr. Nkiruka Bridget at OBGYN with Dr. Adazayo, and drop your comments and I will answer them. Please like my live. Thank you guys. Thank you, thank you, thank you. I want us to talk about how to take care of your health. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Hello, Tracy, you are welcome. Tracy, you are welcome. Tracy, you are welcome. Please drop your question. Thank you for following me. Please like this and share. Thank you. My name is Dr. Nkiruka Bridget at OBGYN with Dr. Adazayon. I made a video here. I made some points here. I don't know how I'm going to explain it, but I just want us to talk about how to take care of our health as women. If also as men, there are a lot of things that happens in the body that if we don't take care of it, it may affect us adversely. And from the previous video, I've discussed about a lot of things. I've discussed vaginal discharge, I've discussed amenorrhea, I've discussed how to calculate your safe period, I've discussed contraception and family planning, I've discussed how to boost your fertility. So please, if you have any question, you can drop it here. I hope I'm being heard. Tracy, I hope you are hearing me. Thank you. Thank you for coming to my live. Thank you. So, number one is, I just want to bring it to an awareness. I want to create an awareness about self breast examination. I don't know the last time you checked your breast. It's very necessary that intermittently you check your breast. Now, the breast is not supposed to appear nodular and is not supposed to have some masses. The breast is made of fat tissue. So, okay, thank you, Tracy. Thank you for confirming that you are hearing me. I just want to be sure because I'm using a microphone. Thank you so much. So, the breast is not supposed to have masses. The breast is not supposed to discharge milk except the person is breastfeeding. For someone that is not breastfeeding and you are seeing milk discharge from your breast, it is not normal. It could be as a result of what we call microadenoma or macroadenoma of the brain. It can also be as a result of hyperprolactinemia. It's hormonal sometimes in women. And sometimes for a woman that is trying to conceive, it can affect the person's ability to conceive. So because if that hyperprolactinemia that is causing that breast milk discharge will suppress the person's ovulation, the person may not ovulate. It's mostly seen in anal ovulation or polycystic ovarian syndrome. So that's that about breast. So if you're not breastfeeding, your breast is not supposed to be discharging milk. Your breast is not supposed to discharge greenish substance. Any greenish substance coming from the breast is actually could be malignancy. And malignancy means can be something that is cancer and should be looked into in the hospital. Any breast that is bringing blood, it's not normal. Now, for some women that are breastfeeding, you see that maybe they have what we call mastitis because they are not latching the baby well. Part of the breast will get engorged and could be secondarily infected, and that breast will start bringing out pus. That's this thing should actually, if there is mastitis, that is inflammation of part of the breast tissue, the person should seek medical attention because if it actually has been secondarily infected, we'll place the person on antibiotics and can drain it, that pus. So breast self-examination is very necessary, not just for a woman, but also for the men. So far the person has anything on the chest, whether just a nipple in the case of men or has breast developed like a woman. Breast lump can be benign or malignant. Benign means that it is not cancerous, while malignant means that it is cancer. But if detected early, that can be removed and the person will go on to live his or her normal life. And so breast self-examination is very, very necessary. If you notice anything that is abnormal, like in this part of the world, if you are less than 40 years and you see a lump, we'll do breast ultrasound. But if you are above 40 years, you are requested to do a mammogram. It will pick anything that is abnormal and be able to interpret it and be said, okay, please go in for this. You can go in for fine needle aspiration cytology, or you can go for lumpectomy and send it for histology. If it's cancerous and we notice the stage, we can go and remove the whole breast. So it's not necessary we check our breast regularly. Then the second thing I want to talk about is cervical cancer screening. Cervical cancer is what affects the women. Cervix is actually the mouth of the womb. It is the opening to the womb. So that cervical cancer has a pre-malignant lesion. That is why it is good, because it has a pre-malignant lesion. Before the cervix will develop a cancer, those pre-malignant lesion means the first diseases that come up before it becomes cancerous. If detected early, the person goes on, will remove the tumors, the person goes on to live a beautiful life. Now, the screening for cervical cancer is postulated that depending on the location you are, if you are sexually active or has had sexual intercourse in the past, because the cause of cervical cancer is the virus we know as human papilloma virus. However, there are risk factors. Risk factors to cervical cancer: someone that is sexually active, someone that has multiple sexual partner. Then if you don't have multiple sexual partner, however, you have partners that have multiple sexual partner, you are at risk of cervical cancer. So the person having being faithful to one partner but has multiple sexual partner, the person is at risk of cervical cancer. And so having multiparity, smoking, so family history of cervical cancer before, or family history of any cancer in the family, the person is at risk of cervical cancer. Or for just being a woman, so the person is at risk of cervical cancer. And what does the person do? We advocate that screening is done from 21 years. The person starts screening every 3 years. We can do pap smear. Pap smear is done every 3 years. That's the screen I'm talking about. Mostly use of pap smear. The other screening method, but I'm discussing pap smear now. Every 3 years, you do your pap smear. And if it's normal, you continue to do it every 3 years till you are 29 years. From 29 years, you are expected to start doing both pap smear and human papilloma virus screening. Human papilloma virus is the virus that causes cervical cancer. So you do it every 5 years until the individual is 65 years. However, if the person has done cervical cancer screening and is 65 years, and for the past, looking retrospectively, for the past 10 years, the screening has been normal, the person is allowed to go. But if the screening has not been normal, we'll continue to follow the person up for the next 10 years to be sure that the person does not have any risk factor to cervical cancer. Now, the next thing that we do is, if the individual is immunocompromised, maybe is infected with HIV virus, has lupus erythematosus, or any autoimmune disease that is suppressing the person's immunity, the person is advised to do continually cervical screening every 1 year. If any disease is detected, the place is removed. Either we burn it off with cold knife, or we just biopsy the place and cryotherapy the place and make the place that the place is fine. So the person goes on to with his her life. So that is for cervical cancer screening. Please, if you are following me, please click the notification button, subscribe to my page and share this video. Like it too. Give it a thumb up so that more people will come to watch it. Now, that's for cervical cancer screening. If detected early, the pre-malignant lesion, the person will not go on to have cervical cancer. The person will live a normal life. However, if it becomes cervical cancer, most times we'll have to go and do what we call total abdominal hysterectomy with bilateral salpingo-oophorectomy sometimes. Because if it has extended, we want to remove everything and allow the person to live a normal life. That about cervical cancer. Now, the other things that women should do is you should not douche. Douching can disrupt the ecosystem. I've discussed it in the previous video, but let me bring it to this life. Douching can disrupt the ecosystem. The vagina is made in a way that it is comfortable. Both good and bad bacteria cohabit comfortably. Each help each other to live. There is no war going on in the vagina. But when you start putting your hands, douching means putting your hand inside the vagina to start washing. Some wash with soap, some wash with douche gel, some wash with a lot of things, some even put vinegar inside. I don't know what you are looking for. No, you're not supposed to douche. Allow the vagina. The vagina and another part of the body is self-cleansing. Only two of them are self-cleansing. That's actually the vagina and the ear. You're not expected to put something in your ear too. So for your vagina, you allow it to self-cleanse itself. The only thing that's supposed to pass through the vagina is for those that are delivering vaginally, the head of their baby and the penis of their partner. So you're not supposed to douche. You just wash the external part. The external part is what we call the vulva. So if you start putting your hand inside, trying to disrupt and remove a lot of things, you are beginning to douche and you will disrupt the organisms that are there. You may remove most bacteria and the fungi will overgrow. The person will start coming with yeast infection and will start coming with abnormal vaginal discharge. The person will start coming with itching there, and even the vaginal discharge may become foul smelling. With irritation, it could become inflamed, and the person will start running helter skelter. So don't douche, don't insert anything in your vagina. The vagina is already made healthy the way it is, with its ecosystem balanced. They are supposed to live in a normal method. Please, if you have any question, you can drop it here before the live ends. So that is that. You're not supposed to be on prolonged antibiotics. For those in the tropics, most times you will see that you are prescribed an antibiotics, they go over the counter to start buying those antibiotics. No, it's not proper. Prolonged antibiotics can also disrupt the vaginal bacteria, may kill most of the bacteria, and the fungi will overgrow, and the person will come with a lot of problems, vaginal itching, vaginal discharge. Now, other things that can cause vaginal itching is that some people react to some soap. If you have reactions on your body, that same thing you are reacting on your body can affect your mucosa, because the vaginal mucosa is also part of your body. So the person is not expected to douche, not expected to put irritants into their vagina. Now, other things that can cause vaginal itching. I'm not diverting to vaginal itching. Okay, they said my phone is overheating. I don't know. My phone is overheating, that it will automatically close. So as we go on to discuss, if you have not subscribed to my page, please subscribe to my page at OBGYN Talks with Dr. Dazayon. Follow me on Facebook and there. Is it normal to have mucus discharge when you have fibroid? Now, Tracy, if you have fibroid and you are having vaginal mucus, it is possible that that fibroid is inside the endometrium. And sometimes it will have different types of fibroid. I just hope that it does not automatically close. This YouTube is about to close. I don't just hope it doesn't. So if you have a fibroid, you have different locations of the fibroid. The fibroid can be inside the uterus, endometrium, where the baby lies. We call it submucosal fibroid. The fibroid can be on the muzzle of the uterus. We call it intramural fibroid. Fibroid can be outside on the surface, the skin of the uterus. The uterus is the womb. We call it subserosal fibroid. So fibroid in the subserosal and intramural will not cause vaginal discharge. However, if the fibroid is submucosa, ultrasound should be able to find where the location of the fibroid is. If the fibroid is submucosa and is pedunculated, pedunculated means it already has a stalk. It's no more attached so well, it already has a stalk. So if it has a stalk, it may be irritating around the cervix and the person will come down with vaginal discharge. So it is very possible to have fibroid and be having abnormal vaginal discharge. But what matters is the location of the fibroid. If it's intramural fibroid and there's no submucosal fibroid, the person will have vaginal discharge. But remember, just note and be sure that it's not normal vaginal discharge, because every woman has normal vaginal discharge. From the time of your menses towards the ovulation, your vagina, you start having vaginal discharge. Initially, they become very scanty and thick. But as you approach your ovulation, the vaginal discharge increases in quantity and it becomes thicker and maybe stretching but not too stretching. But at the time of your ovulation, the vaginal discharge becomes thin. As it becomes thin, you see it's also transparent. In fact, you can actually form a string with it. That is actually the time the person is ovulating. And those are because of effect of hormones of the body. Now, when the person has ovulated, the vaginal discharge also becomes uh, copious and it start decreasing again, but no more be stretching. Doctor, is it normal to have mucus? Okay, can you, sorry, let me see this chart now. Can you also have excessive hunger but in the midnight with fibroid? except for unusual presentation of fibroid. Excessive hunger in the midnight does not go with fibroid. Fibroid does not cause release of things that will cause you hunger, except if the person has hypoglycemia. I've not heard of fibroid causing hypoglycemia, but there's nothing that is so called unusual presentation of fibroid. Like now, do you know, fibroid can cause, fibroid is supposed to cause someone to lack blood, can cause excessive blood when it's impeding on the vessels that are supplying the kidney. The body will not will take it as there is no enough oxygen, and so the kidney will start releasing what we call erythropoietin, and the person will come with polycythemia. Polycythemia means there is excessive blood in the person's body. That's an unusual presentation. It's not the common presentation. So I have not heard of unusual presentation of fibroid, except if the fibroid has overgrown so much that is impeding on the pancreas where insulin is released, and the person releases excessive insulin, that before you know it, the person is having hypoglycemia. That should be an unusual presentation, not the common presentation of fibroid. So at that time, if I would advise you, Tracy, you can just get a glucometer, so that at that period of the night you check, did you, but one of the question I want to ask you, do you actually eat very well before you go to bed? Now, if you eat very well before you go to bed, is there any underlying condition you are having? Are you on drugs? Do you have diabetes mellitus, excessive blood sugar, that you are placed on drugs? If you are placed on drugs, it's possible that those drugs may be causing you those excessive hunger. Excessive hunger at the midnight may be a sign of hypoglycemia. So if you get a glucometer, at that period that you have experienced that excessive hunger, you can just do your blood glucose test and see if the level is abnormally low. If the level is abnormally, that means you are really having a hypoglycemia, which could be from any other thing. But if it's an unusual presentation of fibroid and truly you can't find any other thing that is causing it, I would advise that you remove that fibroid, because as the fibroid is staying there, it is growing. However, for people who don't remove their, if fibroid becomes symptomatic, it starts giving you problem, it starts impeding on some structures in the body, it starts causing excessive bleeding, it starts causing excessive anemia, we advise you to remove that fibroid. So that is what I have to tell you, Tracy. I don't know if you have any other question, you can drop it there. So unusual presentation of fibroid, if it's impeding on the pancreas where insulin is released, the insulin may be released in excess, and the person will, that insulin will mop up the glucose in the blood, and the person will come with hypoglycemia, that is excessive hunger in the night, and it shows like that. So if you feel such thing, just please drop something, a sugary drinks around you, so that you can have something to eat, because hypoglycemia, if you actually do the test and it's hypoglycemia kills faster than hyperglycemia, so we don't want you to enter into hypoglycemia. That's that about fibroid. And I don't know whether I answered your question, Tracy. You can go on to drop any comments or tell me anything. However, if you come across this live, please hit the subscribe button. Just subscribe to my page. Yes, Tracy, doctor, summary, fibroid will not cause hunger, except if it's an unusual presentation. One of the characteristics of fibroid is not causing hunger. That is not its common characteristics. So we have to find out what is causing that excessive hunger. So that's that. We have to find out what is causing that excessive hunger. So thank you for asking your questions. I was asking something. So fibroid can be anywhere. In fact, some few days ago, I had to remove a pedunculated fibroid from the uterus. You know, most fibroid surgery is done through the abdomen, but if you see it and it becomes pedunculated, Tracy, thank you. I love you so much. Thank you. Please share my page and invite others to like it too. I need my page to go viral. Please. Thank you for watching. I'm very grateful. So, thank you. Love you, Tracy. Thank you. Please invite your friends to watch my page. Share my videos. Thank you. I'm so grateful. So, thank you so much. Now, fibroid can be anywhere. Thank you, dear. Thank you. I'm so grateful, Tracy. Thank you so much. Thank you. Thank you for supporting me. Thanks. So, fibroid can cause these things I mentioned. However, I've seen fibroid cases coming with discharge because they are pedunculated. Pedunculated means that they are in the uterus and they are trying to come out on their own. You just see open the some that person's private parts to examine and you are seeing something inside. So when you notice you do and you see that is a tumor, it will draw the cervix up, and in that case we tried as much as possible and removed it through the vagina. We just had to squeeze it and remove it from the stalk and achieve hemostasis, stopped bleeding, and the woman is fine. So anything, fibroid can cause these things. However, it has its unusual presentation. Those are the type of unusual presentation. Then, people in these tropics have been told that they can insert anything and you deliver fibroid. Please, there is nothing to insert to deliver fibroid. Fibroid treatment can be medical. Medical treatment can be surgical treatment, can be radiological. Now, under medical treatment, okay, what is the color of fibroid discharge? Most times is you will just see yellowish vaginal discharge that is non-foul smelling. However, that does not mean that all vaginal discharge is from fibroid. So, but the one that I have seen, most times you see yellowish vaginal discharge. In fact, if you look at it, you think the person has cervical problem until you examine the person in theater fully under anesthesia. Then you now be able to say, this one looks is tumor. So most times it's yellowish discharge or just discharge that is coming out white, but it's not foul smelling, it does not smell, it does not smell like cervical cancer discharge. So that's about um, fibroid. Okay, I was saying something. No, it does not look like mucus in the nose. It just looks like ordinary discharge, Tracy. Anything that is irritating that place will not give you mucus discharge. It could be watery or just stark discharge. Mucus in the nose is mostly from ovulation. Well, that's why we call it stretchy thin mucus. Stretchy thin mucus will give you mostly from ovulation. It's stretchy, it's like the one coming from the nose, but it's transparent and it can form a very string with it. So the one from that is not, no, it's not. It's not because why it's releasing mucus is because it's irritating the cervical area and the vaginal area. With irritation, the body will start trying to react to it and that's still discharge from it. Friction around it, that's actually what leads to that um, the discharge. However, if it becomes secondarily infected with bacterial infection, it can start becoming foul smelling. That's about that. So I was discussing the method of fibroid treatment. Medical treatment. If the person is not fit for surgery, we give the person medical treatment. If the person is having excessive bleeding before the time of the surgery, because most fibroid surgery would like to do it at the follicular phase. Follicular phase is the month from your menses before you ovulate. So we want to do those fibroid surgery at the follicular phase. So we can place the person on medical treatment. If the person is having pain, we give the person analgesics. If the person is having excessive bleeding, we can give the person drugs to prevent the bleeding. If the person is having other things, we just give drugs to manage the symptoms. Now, if the person is old, because fibroid feeds from the hormone. Thank you, doctor. You just good. God bless you. Thank you, Tracy. I'm so grateful that you've been following me. You followed my vaginal discharge video, and I'm grateful. Please just share. I want others to subscribe. Thank you. So, if the person is about to enter menopause and has fibroid that is actually not disturbing so much, we can give the person drug, hoping that as she enters menopause, the fibroid regresses because the hormone, the estrogen hormone feeding the fibroid, by the time the person is entering menopause, the estrogen hormone has reduced, and so the fibroid will start shrinking in size. And if it was giving symptoms before, the symptoms will go. That is area for medical management. However, surgical management could be open surgery or laparoscopic surgery, depending on the size of the fibroid or the patient's option for management. After we have canceled the individual and you want either open surgery or you want laparoscopic surgery, you can go for any of them. we use it to remove the fibroid. Now, another option of management is if the person has what we call radiological management. We do what we call uterine artery embolization. It's actually done with ultrasound guided. You put something into the uterine vessels using the iliac artery, and it goes there to stop supply to that fibroid, and the fibroid will shrink. Because if you stop supply to that fibroid, the fibroid will actually shrink. Now, another one is what we call high intensity focused ultrasound. We call it HIFU. You use ultrasound to burn the fibroid, but use high intensity ultrasound to burn off the fibroid. Just focus on the fibroid, and when you are done with it, you leave it. Before you know it, the fibroid shrinks. These are the options of management. But the definitive treatment for fibroid is hysterectomy, removing the uterus. You know, it lives in the uterus. So if you actually remove the uterus, the fibroid will go. Now, another unusual presentation of fibroid is what we call it will just parasitize and leave the stalk. Let's assume for someone that has what we call subserosal fibroid, the fibroid will just remove from its stalk and will just start go and implant in another place on the abdomen, the stomach. Like if he goes to the omentum to implant there and get another blood supply from the omentum, it will totally detach from the uterus. That's another unusual presentation of fibroid. It will just detach and it will seem tumor in the stomach, but you don't know that it's fibroid. So these are the ways fibroid can present. Now, that is that for fibroid. I don't know if there's any other question. Now, follow my page. I was trying to calculate how to get safe period here. If someone has 28 days cycle, we assume that the person ovulates at the 14th day. If someone has 30 days cycle, this is 30, we assume the person ovulates at the 16th day. This is the 16th day. Now, ovulation will help you to calculate a lot of things when you are safe for intercourse, when you are unsafe for pregnancy, in case you want to plan yourself. Calculating the ovulation time will also help you to choose for someone that is looking for any particular sex, whether you want a male baby or a female baby. Calculating it will help a lot. I'm going to drop the video on my channel very soon. So I made the video actually today. So I'm going to drop it after editing it on my page. Please subscribe to my YouTube page if you want to watch, like my page and share it. So the time from ovulation to the menses is the one that is constant. From the time of ovulation to menses is constant. From the time of menses to ovulation, the one we call follicular phase is not constant. That one can vary. That's why some people you see them, they say that their menses comes every 28 days, but today it came at 33 days. It is still within normal because the normal menstrual cycle length is from the 21 days to 35 days. So it is still within normal. So anybody that has varying of this cycle length can use this to calculate when you ovulate. So your ovulation day is 14 days from your ovulation to your next menses. Calculating it will help the person. Then other symptoms in the body. Some people used to feel sharp pain around their abdomen, maybe on the left, on the right. And you notice that that pain is actually mid-cycle. If you remember the time you have your period and when you have pain, be like, this pain, no, some people will feel it and be so uncomfortable, not knowing that it's ovulation that is happening. So it's also a sign that somebody is ovulating. Then that cervical mucus that I talked about becomes stretchy, slimy. I don't want to bring something that looks like it here. Constantly slimy. So that is one. Then another thing is an increase in basal body temperature. The temperature of the person that is using a very sensitive thermometer increases by 0.5 degrees centigrade. So these are the methods to find out if someone is actually ovulate. I want to appreciate if you have watched to this point. I think I will be leaving. Tracy, I don't know if you have any question. I don't mind. I can oblige you any question. You are my friend already. Thank you, my cheerleader. I'm so grateful. So if you have any question, please, you can drop it on the comment box. I will answer them as much as I can. I'm a consultant obstetrician gynecologist. I practice in Nigeria. So I take care of women and their babies. I take care of people that have fistula, vesicovaginal fistula, rectovaginal fistula, because in the tropics, in this part of the world, it is very rampant. And what we know initially as the cause of vesicovaginal fistula, that is leakage of urine through the vagina. The person cannot control her urine. What we know before is obstructed labor, but we have made a research, we have documented it that the current cause of vesicovaginal fistula in this part of the world is polyperform cesarean section, because a lot of people that are not qualified and they are not being controlled by the government are opening hospitals everywhere. You can see someone that did not even go to school, just that he went to a place and, okay, doctor, can you explain yellow mucus discharge stretching? A lot of things can cause yellow mucus, yellowish. In fact, Tracy, normal vaginal discharge is not supposed to be yellowish. If it's infected by fungal infection, for example, Candida albicans, or any other form of yeast infection, it can actually be yellowish. If it's infected with what we call trichomoniasis, it can actually be yellowish. Gonorrhea discharge most times is yellowish. So it's like a drop in the mucus but stretching. It may just be that the person is ovulating but has an infection with yeast ongoing. The person is ovulating, but if it is brownish or blood, some people during their ovulation used to have what we call spotting. It's just an injury around that place that she ovulated. Remember, ovulation is just about rupturing something. It ruptures, and so fluid, and sometimes injury may happen around that place that actually is by fibrosis. So when the injury happens, the body may pick it. Yeah, drop of blood. Yes, that's what I'm talking about. It could be a drop of blood, not yellowish. Is it that brownish? If it has stayed for a long time, it will be brownish, or it will be frank blood. If it's tiny, before it gets to the uterus and comes out, it will become brownish because the body has acted upon it and it has stayed longer. So if it's brownish or frank reddish, is blood, is a drop of blood, it is normal. Some women have it normal. It's just an injury at the point they ovulated. That injury will be picked and it will be transported into the uterus, and the body releases it. It comes out through the cervix with that mucus, and the person will say, I am spotting. Most times it's not spotting, but if it comes not during your ovulation, there's something wrong. It may be something, in fact, that means it becomes abnormal bleeding, and the person will have to check it out to be sure it's not these premalignant cervical lesions we are talking about, to be sure it's not any other abnormal dysfunctional uterine bleeding happening. So that's that about the blood following mucus. It's okay. It's during ovulation, it's okay. So Tracy, hope I've answered your question. I was saying something, I've forgotten it again. So thank you. Tracy, do you have any other question at the end the live? I'm still in the hospital though I finished what I'm doing. So thank you for following me till now. I am grateful. Please just help me share. Invite more people to like my page, to subscribe to my YouTube page. If you're on Facebook, I'm also on Facebook. So I discuss everything about medical health. I love you, Tracy. Thank you for staying with me. Thank you, thank you, thank you. I love you. See you next time. I don't know if you have any other question. Drop of blood outside ovulation. No, 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 no. It's not normal. It's not normal. Means it becomes irregular vaginal bleeding. Now, if you have fibroid in the endometrium, that is the submucous type of fibroid, it could be a cause of it. If you have cervicitis, there is inflammation in your cervix, it could be a cause of it. If you have cervical premalignant lesions, it could be a sign of a cause of it. If you have cervical cancer, the body may just start, the started cervix may just start dropping blood intermittently. So outside ovulation, it's not normal. Tracy, did I answer your question? Yeah, with mucus discharge. That mucus discharge, in fact, I don't know how old you are, But if you're having mucus discharge with blood outside your ovulation, please do a pap smear. Let them check your cervix. A doctor needs to look into your cervix and see if it's healthy. If the cervix has inflammation, there's something we call cervicitis or entropion. There's something, another thing we call entropion on the cervix. The cervix inside is infolding out. And so the person may start having vaginal discharge and bleeding. So, but somebody needs to look at that cervix with speculum. You look at it. If there's an abnormality, the person will go for colposcopy, or whoever that is happening to advise the person goes for colposcopy. If it's outside ovulation time, it's outside the menstrual period, it's not normal. It's not. Hello, Tracy. Tracy, thank you. Thank you. Hope I've answered your question. Thank you. Thank you, YouTube. YouTube, please share this video. As Tracy is sharing, YouTube, please share this video. YouTube, share this video. I want people to subscribe to this page so that we'll do more of live coverage. Tracy. Tracy, if you check through my YouTube channel, you can send me super thanks, you can send me gifts, you can just so that I'll put you in my membership club. So if you want to let me know. Thank you, Tracy. Thank you, Doctor. I'm satisfied. Take care. Take care, darling. See you next time. I'll be ending this live now. Thank you. Thank you. Thank you. Thank you.